We proceed to interviewing. Case history: fibroids due to phlegm and blood stasis. A 43-year-old woman had been suffering from heavy periods for 15 years. The periods came regularly, lasted 7 days, and were not painful, and the menstrual blood was dark with clots. The heaviest flow was in the first 3 days of the period. A month before her consultation, a scan revealed the presence of fibroids in the uterus. Her body build was robust. Her eyes had good luster, indicating good spirit, and her general energy was good. She was rather overweight, and her complexion was sallow. She had no other symptoms apart from occasionally mucus in the stools. Questions investigating a possible kidney deficiency revealed no symptoms of it. On palpation, her abdomen felt quite soft, and the fibroids could not be palpated. Her tongue had a normal color but was very swollen. Her pulse was slippery, full, and slightly overflowing. Her body build, good spirit, and general energy indicate a good constitution, although being overweight indicates phlegm. The presence of phlegm is confirmed by the presence of occasional mucus in the stools, her being overweight, the swelling of the tongue, and the slippery pulse. The fibroids also could be partly due to phlegm. The dark menstrual blood with clots and the presence of the fibroids themselves indicates blood stasis localized in the uterus and not severe enough to turn the tongue purple. In this case, we can therefore conclude that the fibroids are due to a combination of both phlegm and blood stasis. The softness of her abdomen on palpation indicates that phlegm is the predominant pathogenic factor in the formation of the fibroids. The two major causes of heavy menstrual flow are usually Qi deficiency or blood heat, and in this case, it is due to blood heat. There are not many signs of this because the tongue is not red, but it is shown primarily by the overflowing pulse. On the other hand, there are no signs of a spleen or kidney deficiency, even though the spleen must be deficient for phlegm to form. In her case, there are probably not many symptoms of deficiency because of her good constitution. This is also shown by the full pulse, which although it does indicate the presence of a pathogenic factor, it also indicates that the upright Qi has not been severely affected. In this case, it is necessary to treat her three main conditions, that is, phlegm, blood heat, and blood stasis simultaneously, and the treatment principle is therefore to resolve phlegm, cool and invigorate blood, and stop bleeding. Thank you for your attention.